Ladies and gentlemen, we now move on to our next panel discussion, Aesthetic Tweakments, New Treatment Modalities for Face and Body. How are dermatologists customizing treatments as per patients? What body types and facial features are the new aesthetic goals? Where and how can patients be stopped who are obsessed with beauty and the treatments? And there is so much more that we can add to this list, but if these are your questions, this session will have you covered. I'll begin with inviting the session moderator, Dr. Apratim Goel, Medical Director, Cutis Skin Solution. Thank you for joining us, Dr. Apratim. I request you to please take your seat till I introduce all the panelists. A few words about Dr. Apratim. Received her MD DNB Dermatology from Kasturba Medical College, Manipal in 2000. With 20 years of experience, she is on the scientific panel of various national and international professional organizations. She is a trainer as well as a pioneer in various lasers, derma rollers, botulinum and fillers. She has special interest in Medispa, infusion therapy, lasers and practice management. To be up to date on the new technologies for skincare, she has been attending extensive training courses on various lasers, thread lifts, mesotherapy, botulinum toxin fillers and other cosmetic procedures at prestigious institutions in India and worldwide. Having traveled the road to success, she is keen on training the upcoming doctors in aesthetic procedures and runs her own training courses. I would now like to invite our panelists who would be joining Dr. Apratim for this session. Please welcome Dr. Malvika Kohli, Dermatology and Aesthetics Director, Skin Secrets. With over 25 years of experience, ladies and gentlemen, a little bit of an applause here, please. Thank you. With over 25 years of experience in the field of aesthetic dermatology, Dr. Malvika Kohli has introduced many new procedures in India. She is the Director of Skin Secrets with the Dermatology and Aesthetics Center of Excellence located in South and North Mumbai. She is an international trainer for injectables, has written chapters on chemical peels, microdermabrasion and hair cosmetics in the IADVL textbook of dermatology. She has been a cosmetology consultant to premier events such as Lakme India Fashion Week and Pond's Femina Miss India contest. Please welcome Dr. Pankaj Chaturvedi, MD Dermatology, Hair and Transplant Surgeon and founder of Medlinks. Dr. Pankaj Chaturvedi is a new generation dermatologist and skin specialist from Delhi. He is a dermatologist of international repute and specializes in advanced skin and hair treatments. After graduating from prestigious AIMS New Delhi, he co-founded Medlinks, a center for advanced dermatology and hair transplants. Because of his passion for delivering more beautiful and natural-looking results for patients, he has also developed a series of world-first non-surgical procedures which have earned him an international reputation. Dr. Pankaj is one of the first Indian doctors to be felicitated in House of Commons British Parliament for his contribution to the field of dermatology in 2018. Please welcome Dr. Rixin Pereira, Consultant Dermatologist and Head, Dr. Rixin's Derma Therapy Clinic, Mumbai, and Consultant Dermatologist, Holy Family Hospital, Mumbai. Dr. Rixin is a certified dermatologist with more than 11 years of experience in private practice. He has experience in treating skin, hair, nail conditions, leprosy, and sexually transmitted infections. He also has more than 10 years of experience in aesthetic medicine, including lasers, botulinum toxin, fillers, peels, radio frequency, and other energy-based devices. He has worked with several leading filler and botulinum toxin brands. And please welcome Dr. Soma Sarkar, dermatologist and aesthetic physician, Dr. Soma's Aesthetic Clinic and Academy. Dr. Soma is a well-known celebrity dermatologist with more than 10 years of experience in the field of aesthetics and clinical dermatology. She is an MBBS and MD in dermatology, has created a niche in training budding doctors in anti-aging procedures all across the globe.
So, what about the audience questions? Okay. So, we'll take the audience questions in the end. So, we are talking about trends. We just have finished Cannes Festival, right? We had Met Gala Awards. Hi, Gitanjali. Met Gala Awards. So, what I always tell... No, back. What I always tell my doctors who work is that don't just dig yourself into dermatology textbooks. Be aware of what's happening in the world. Because, something happens like, whatever. We'll discuss the trends in the session. So, your patients expect you to be aware of that. Your patients expect to discuss that with you, and of course, some solution. So, I have a very star-studded panel here. Of course, Shriyal has introduced them, but I would introduce them my way. So, Malvika, Dr. Malvika, when I think of Malvika, I think of as a diva. So, I call her a diva of dermatology. So, ever since I have joined dermatology, I have seen her ever so graceful. She's so polite. She'll always pick up a phone if even I have to ask something. She's stylish, to me a bit mystery also, and a lot of fun. So she is my panelist today. Welcome, Dr. Malvika. I come to Pankaj. So, I was trying to look for Bollywood faces, which I relate my panelists to. So, so Pankaj, yes, he is good looking, handsome, stylish, modern, trendy, and I would have said handsome with brains, but in this context, I would say beauty with brains. So, welcome, Pankaj. Now, Rixan Pereira. Yeah. I was trying to match faces as well. So he is very trending. For somebody 13 years in practice, I would say very daring. He's a fun person. Quick learner, again mysterious and very charming. And I guess that's where you hold all your female Bollywood celebrities with you. Thank you. So, welcome, Rixan. And Soma Sarkar. Now, Soma Sarkar, to me, she is like a bundle of talent. And she is so humble about it. I've seen her teaching juniors, and she really does share. So, welcome, Soma. I call her a big promise in small package. Right? So, welcome you all. Now, the whole idea of this session is that we don't go into so much detail because we have a limited time on hand, and we do discuss the trends, how this has shaped our current practice, what are your celebrity, doctors, how are your patients asking and how are they responding to those, right? So, I will throw some questions. I would want whoever has to chip in their opinion, please pick up the mic and tell me. And if I'm going too fast, then audience, please tell me. So, okay.
Last we'll introduce Dr. Apritam.
Thank you. So, trends, right? Trends change, evolve, tweak, and that has an impact on our practice. I remember way back in 2002 when I started practicing, there was one filler for the whole face. I would use the same, we didn't even know chin can be injected. We didn't even know that jawline ever existed, right? So, of course, it changes. We as practitioners, aesthetic practitioners, we pick on those things, the magazines, our patients, conferences, all these help us. So, pandemic has definitely changed the face of aesthetic practice. There is increased awareness of skin problems. Patients who were sitting with, heavy chins, now suddenly I think it's flipping. They suddenly have become aware now of these, and then they come and ask. Maybe they are pushed by somebody, or they come on their own, or they see your Instagram page, but at least they have come to your consultation chamber. The use of face mask during pandemic, I think it came as a boon to us. I know nobody's wearing now. I think we're out of it. But yes, because that made us do a lot of procedures where we would involve a little downtime in the lower face. Social media is ever more powerful. I think everybody got time to be hooked to Instagram on their phones. So it got ever more powerful. And we as practitioners realized how much this can help us in our practice, how much we can reach to our clients through social media. Our treatments are affected by the demands which are made day to day by the patients. The recent red carpet trends have changed the way we practice. Met Gala awards, Cannes. If you just scroll through how Kim Kardashian has arrived at Met Gala, it's again a very trend thing. And I think all of us here have to be totally aware of what's going on around the Lakme Fashion Week and etc. Now, as practitioner, we have to be aware because, and also at the same time, the industry outside, they are actually aware of this. They are coming up to you with technologies, with solutions. So it just falls all in sync that we all have to align ourselves similar way. So let's dive in. So, there is more a demand for camera-friendly face, even if in reality the face looks a little malnourished or too small. On screen the face will look nice. The brows, if you see, the brows have really changed. Now there are shorter brows, flatter brows, flare brows. I would take that as a side effect though, otherwise, or a mistake, but now it's trending. Russian lips, flip lips, lip tints, body trends. There are a lot of body contouring which I would involve my panelists. Fillers, a filter-free skin, and a new thing is work from home skincare regime, which is a bit different than when you are going, when you are going to your office. So let's start. We'll start with fillers because that's a favorite topic with all my panelists. Dr. Malvika, there are a lot of newer fillers which are now available, especially last 2-3 years. Also, there are biostimulatory ones. Would you share your experience that what has added to your practice lately?
Thank you, Dr. Abritam. That was a wonderful introduction, and
Thank you.
I love your sense of humor,
Thank
amongst many other things.
Thank you.
It's wonderful to be here with all my esteemed panelists, and wonderful to have you as an audience. I would say that the best part about fillers today is that we understand the product, what we call rheology, that means the specifics of a product. And so therefore we know what we are using, where we are using, why we are using, how much we are going to use where. And that has revolutionized the way faces look today. Earlier, like you said, we had that one syringe and only one product. We only put it where the patient told us to put it,
Yes.
which was always nasolabial folds. It began and ended there. And then slowly we evolved to the mid-face, and then slowly we evolved to the lips, and then the tear trap. But it was that same syringe or
Correct.
that same product.
Correct.
Now you can customize. You can. Companies are bringing out portfolios of different levels of hyaluronic acid, which we all popularly use. And the hyaluronic acid is placed, like I said, strategically, and you get a wonderful result with natural expression. And of course, you have to use more than one syringe, but you can now help to prioritize with the patient which area you'll use, start with first, where you see maximum change, and then we go to other areas. So you have to plan the patient out.
True.
I think now we all make longer road plans for our patients for 6 months to a year, so they know where they're headed and they know how they're going to look.
True.
And the biostimulatory have really revolutionized because they're helping in producing your own collagen, your own hyaluronic acid, and that's very appealing to patients. So biostimulatory means your own. And so they get very happy to know that they're not going to be filled. They're going to be boosted.
Right.
Their own skin production is going to be boosted. That's actually created quite a revolution.
So we have new fillers in the market now, which are bio. Some are not available yet in India, but then we do have things like Profilo, which I think are doing well. Your experience, Dr. Pankaj, with biostimulatory fillers?
Mixed experience, I'll say. So it depends. First of all, we need to see what patient is looking for. For the hydration, there have been fillers with the different brands.
Yeah.
We have been using since a couple of years. Newer ones which have been launched, in my experience, they work really well when we treat the thin and skin with a lot of wrinkles.
Okay.
Typical Indian skin, which is thick and where the excess of volume and sagging is the main concern, they do not work that well. Or if they work, the results are not sustainable. They don't last for a long period.
True.
Also, if we see the cost and longevity, that's not that great.
Yeah, so talking of that, we use them for face and neck. Is there a difference in your results in face and in neck, Pankaj?
I particularly find them better for the neck.
Yeah.
Better for the neck.
Yeah.
And let's see the other, the real biostimulative fillers that are awaited. Most probably they'll get licensed next
Right,
year.
right.
And they'll be the real game changer.
Right. No, I'll stay with Dr. Pankaj. Dr. Pankaj, what are the new techniques you've adapted in fillers now? When you do fillers, is there lately something which you've...
So in the injectable practice, we learn, and eventually the new trends and new protocols, they start. We start with the needle.
Yes.
Then we came to the cannula. Then again we came to the needle. and now we are again shifting towards cannula. So
Right.
I use mixed technique in my practice, depends which area I'm treating.
Let's say you're treating lips. Would you use a cannula?
Not at all, never in fact.
Yeah. So we don't really use. What about you, Dr. Malvika? You use a cannula for lips?
Yes, I would use a cannula if the patient wants no bruising at all, cannot sex. Sometimes you have patients who come and say, I'm going for a lunch in 2 hours, or I have an event at night. They just last minute want to do it. You know how it is.
Do you get the same precision with a cannula what we can get with needle?
You can, but
Yeah?
it requires some amount of understanding.
What
of the
gauge?
I prefer to use the 27. 30 is like using a needle, then I'd rather use
Yes,
a needle.
yes.
But 27, yes, works, and it helps you. You need to have a little more knowledge of the depth, and you have
Right.
to place the product very smoothly.
Right.
But yeah, if there is no need, then I think a needle does the job better in a way.
Dr. Dixon, in the under eye, you prefer a cannula or a needle? Tear trough.
So I mean, it depends on the patient actually what I'm presented with. If there is an under eye bag, if there is this protrusion of the under eye fat,
Fat.
if there is fat herniation, then I prefer giving supraperiosteal with a needle. If there is a hollow and there's no bag, then I go with a cannula and I do the entire eyelid. So it depends on what I'm presented with. It's not the same for every patient. It also depends on whether there is, mid face fat loss. So
As well.
basically, if there is a bag, I go with a needle supraperiosteal. If there is a hollow, then I go with cannula on the under eye lid.
But even with cannula, you go on the bone, right? Or
No. I actually, all cannula procedures I do subcutaneously. So,
okay.
because it's very difficult to, very few areas you can actually get with the cannula on the bone. I think
Except
only on the
jaw.
chin you can get onto the bone. But all the other areas, it's subcute. So it's very difficult to actually get to the bone. So with cannula, I know that if I have to be subcutaneous, then I prefer a cannula. If I have to
Right.
go anywhere deeper, I'll use a needle.
I see. You agree, Soma, with the approach?
Yeah, one thing which I've learned in the whole journey of fillers when we started chasing lines and now is less is more.
Yeah.
This is something what I've learned because a lot of patients now post-pandemic specifically have been very, very conscious about the money they are spending.
Sure.
So that is one thing. Secondly, obviously, it depends upon how the presentation is. Personally, I like my needles more because
Yeah.
I feel it is more precision. You can have a control of the product, how much you are using. Yes, the correction might take one or little more time, but I would still first stick
You
to
prefer
needle.
for a tear trough needle over cannula?
Yes.
So I must say that, I've had this experience where I put a needle, I think I've done a good job. The moment that I remove the needle and I'm visualizing filling of that area. So a needle in tear trough, honestly, now it gives me jitters.
Same
I
here,
have to say
same
a prayer before I put it. So I have personally moved to cannulas.
I'd like to add that in the tear trough, like you were asking, I put the cannula is supraperiosteal. Because
exactly.
the skin and
Very
the bone
true.
is
Very
very,
true.
very close
You
to
can
each
just
other.
graze through
You
the
get
bone
tyndal
when you-
otherwise if you put superficial, and they come with a blob of blue color. I don't know if anybody.
I think technique
Amount
has
of
to do with the
depletion.
material what we are using. So we have materials which can be put superficially also. So
Right.
it all depends upon how the material rheology is also working. I think that also make a difference in the results. And obviously the presentation, how the make and the dynamics of that face is looking at that time.
Right. Soma, also some patients come and you look at them and you feel they are not a candidate for filler.
Yes.
But it's still wrinkly and they are young patients. The whole face is nice and just these wrinkles, they say on makeup it shows and all. What do you suggest there?
So first is obviously we give them various options
Yeah,
because
what?
as a clinic we have lasers, we have chemical exfoliation, we have botulinum toxins as well. But I know that in the moment you talk botulinum toxin, people jump on their chairs and say, no, I'm too young for it.
Yeah, but in under eye we definitely don't do botulinum. So what are the treatment
so
options?
I
for
have again I have an device,
Yeah.
ultrasound device,
Yeah.
which basically is in HIFU, and I have a cartridge which works at a 1.5 millimeters.
Ah.
So that's where I can
So
take a use of
HIFU.
it. I combine HIFU. Sometimes I combine it with a Q-switch laser as well.
Right.
So I do it in series. I don't do it one everything, but I can combine multiple treatments, and that's how I treat it.
Dixon, under eye crinkly skin.
I would do a light filler. I do it with a cannula and do it
Light filler means what?
like a Volbella, okay, a Volbella or a Restylane. The technique is different. It's not something that we've been taught. I do something different with the cannula under the skin. It's a different technique.
Oh, you
it gives wonderful
spread
results.
out. Okay.
It gives wonderful results. It works wonderfully for texture. So basically, the plane is between the skin and the orbicularis oculi. I'm not going below the orbicularis oculi. I'm going between the skin and the orbicularis.
Are you not scared of product showing?
It doesn't show. So it
No?
depends. The technique matters. How you place the product. You literally sandwich it between the skin and the orbicularis. It actually gives wonderful results with fine line. It takes a lot of the time. People have very blue, pink skin. It takes care of that also because a lot people who don't have an under eye hollow or darkness, they have a thin layer of fat between the skin and the orbicularis oculi. And a lot of young people have the layer is either very thin or it's missing. So that's where you put in your product. So the thought process behind that is you put in a product which will volumize that plane.
Okay.
And that reduces a lot of the fine lines, a lot of the darkening, a lot of, some people have very fine bags because, they have, because the overlying fat layer is missing. So the deeper fat actually shows through the skin. So the moment you put this filler, it
It's
hides
like a layer,
that.
obstruction.
It camouflages that.
Got it. Thank you.
I use 0.5 ml per side.
So one syringe.
Yeah,
total.
it doesn't give any Tyndall. In fact, I use both. It's just that Restylane tends to give a little bit of swelling, so the downtime has to be explained to the patient.
Okay.
Volbella doesn't give so much swelling, and it's a plane. So the thing is that when you're going in with a cannula, you don't, there are different types of patients. There are some who will have, the cannula will glide smoothly. There's not much connection between the skin and the orbicularis.
So a single puncture you enter and you fan out the entire, like you flood the
I
whole
go in
area.
right from inner canthus to outer canthus.
Okay, but you enter from outer canthus.
No, I enter from the cheek.
Oh.
And I go in from the inner canthus to the outer canthus.
With a single
and
entry.
Single point of entry.
Lovely.
And it depends on, there are people who have, where the skin is really adherent to the orbicularis. Those are a little tougher, especially men. But in women, I find the plane is very smooth. You just go from in to out. And
So
it's
you got
nice.
my next question, Rixan. Fillers in men. So do you inject fillers in men and which are the common indications?
Yeah,
Just
so
that.
I do, but I keep it, with men, I keep it very minimal. It's usually some, maybe over the cheekbone, the chin, and at the most, maybe the gonial angle.
Okay.
Over a period of time, I have actually stopped doing fillers in the jawline, or I use minimal fillers because I've seen that it, even though it looks great immediately post-procedure, it does blunt the jawline in the long run. It creates so I generally keep it minimal when it comes to fillers. I just keep it on the chin, maybe at the gonial angle and the cheekbone in men, but that's about it. Under eye tear troughs I do in men for hollows.
Thank you. Soma, what's new with fillers in your practice? Something which is not discussed so far.
So obviously the biostimulatory fillers, and
Okay.
I have in these recent ones, my nose fillers have definitely gone up.
Yeah.
Though
Nose
it's
filler.
those it's an off-label use. We cannot discuss it on some platform scientifically.
No, here
but
we can discuss.
Yeah, but yes, my nose fillers has definitely taken.
Cannula or needle?
I use a needle.
Okay.
Yeah,
Where
find
is the
it more
entry?
safe. No, so if it's needle, you just put the bridge. You just put it on the bridge of the nose and the tip
So
of the
you are
nose.
probably talking about if there is a bridge, a little spot correction. But do you
spot
do the entire nose
Yes,
reshaping?
entire nose reshaping, like we use the pyriform fossa as well. I also use the toxins along with it for the depressor septi. So it gives you the tip elevation and then I do the nose.
That's why I said daring for you.
Yeah.
So,
Yes.
Okay. Malvika, your experience with nose fillers?
Yes, I think fillers work wonderfully in the nose.
Oh.
I preferably
Cannula.
shy away from the cannula, preferably because it has to go from the tip of the nose, and that's a very vascular area, and you're always worried about any accident over there of, the filler blocking a blood vessel. So, yeah, like Soma, it's actually what we call medical rhinoplasty. So first, we use toxin to correct a flare or tip of the nose pointing down, even nasal flare, and even in the procerus to, calm down the movement here. And after a week or even sometimes right after, but preferably after a week, filler at the bridge, filler at the base of the columella, in the piriform fossa, and then I turn my needle up and even place it over here in the columella to lift the tip of the nose. And I find with this, sometimes I've even put it over here in the ala and eye, just to get the, some people have flared nostrils. So with this, with the needle, I'm very happy.
Yeah.
And I've got good results, but you have to use the right product. So
Right.
sometimes you can use two types of product. On
Yeah.
the bone, you use a lifting, higher G prime product, and then in the nose itself, you use a lighter product for more refinement, so you get a delicate appearance and not a thick, heavy nose.
Right.
But one thing only about this, one reply to your question about crinkly, crepey skin in
Yes.
young people, skin boosters, 12 milligram per ml of HA works wonderfully
How?
well.
Needle or cannula?
Needle.
So multiple. Tuck, 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 tuck.
Yeah, little punctures of 0.01 to 0.02 of the product
Like
placed in
Vital
two
comes with a self tick, like it has a point
ticker,
not one. So if anybody has used Vital, you know that after everything, you can do 100
Yeah.
clicks with 1 ml.
And in this case, the 12 milligram is actually light.
Acha.
Yeah,
Okay.
and because that is 20 milligram.
Yes,
Vital is
yes,
20, this
yeah.
is 12. Lovely, just 2 lines of it, and it gives a lovely hydration.
Actually, I forgot to mention, though we don't have it in India right now, I do not know if a lot of doctors are doing it, but there's something known as plasma pen, which
Yeah,
has been...
we are coming to that.
Yes.
That is a question, but
Yes,
we
it's
can
a
answer that
plasmage
now.
machine and a plasma pen which is available, and you can do it specifically people who don't want to go
What
for
is
surgical
Dr.
blepharoplasties.
So we'll go to
And-
plasma in a bit. Let's not deviate now. I just want quick answer from my panelists. Any one complication with fillers over your career which comes to your mind, and how did you handle it?
Oh, I did have a vascular complication. I did have a vascular
You
complication.
did or you did not?
I did have.
Oh,
I
okay.
did have it
So what
while
did you
doing
do?
a lips.
Which area? Lips.
Lips. Thankfully, the patient was in the same area, so the patient came back immediately.
What did she get?
She had a complete painful violaceous swelling coming up on one side of the lips.
Oh.
And when we did it, we aspirated, everything was done, but still during the procedure nothing happened. She went home after 2 hours, she sent me a picture and there was a huge swelling on one side. I immediately called her, yes, flushed with all the Hyaluronidase, put the patient on steroids, antibiotic cream, whatever possibly. My only saving grace was because the patient was present in and around the area, like she was localite and staying near to the clinic. She could come every day and show it to me.
So how many days and how much Hyalase?
So I had to Hyalase it for 2 days.
Okay.
And 2 vials in one time. So I
Means
did
1500 units, entire thing you put it in one go.
Entire thing in one go. And then after, because she had even after Hyaluronidase, the mucosa swells a lot.
Yeah.
And mucosa is one area where even after Hyaluronidase, you can end up having a reaction. So that's where you have to constantly monitor the patient. So I used to call her every day once to see how she's going or how. Thankfully, there was no necrosis, no scar, and patient
And
has
how
been
many
well.
days did it come to normalize?
Almost 10 to 15 days.
So yes, that's the message that, whenever you are injecting fillers, you need hyaluronidase. It's very cheap. It's only available, the vial with you. It comes as a 1500 units. So you flush the entire filler.
Yes,
Normally we say 75 to 150 per
No,
site
no.
if there is. Okay, lovely. Thank you so much. One Rixon, one complication which has given you sleepless nights.
Exactly. So there have been minor complications, but the one that gave me a sleepless night was, I remember one I was doing, this was way back, almost 8 years ago, when I had done the nasolabial, what we used to commonly do, and I did the procedure, it was uneventful. Next day the patient said, I'm having a little bit of pain. I saw her, it was absolutely fine, nothing. I said it's common after procedure because so it was on a Thursday, and on a Saturday there was no phone call. On Sunday her husband called and he said that there's redness. I said, okay, some redness is normal, maybe it's a bruise. He said, no, it's beyond the area of injection. And I said, send me a photo immediately. They were supposed to go on a 25th anniversary 3-week holiday, and I got the picture and there was a nice red line going up the nose.
So 1 minute, would you describe this line? Was it big? What is the tortuosity, or was it just a...
Yeah. So it was a line that was tortuous, reticular, so I called, and at those days, it had never happened to me before. I didn't have hyaluronidase in the clinic, so I ran around, picked up hyaluronidase from a chemist,
Okay.
and of course I called the company representative who was there to handhold, and of course I put 1500 units all at one go, and hoped for the best because she had to leave on a flight, but it did resolve.
How long did it take?
It took at least a week. There was pain relief was immediate. Overnight she didn't have pain because I got in touch with her the next day. She said the pain's gone. The redness took about a week to settle. Fortunately, it didn't ulcerate or anything. She came back just with one side fuller than the other. But it was good. I've had minor complications, mainly vascular occlusion. I've had it with the most unexpected times. You know, I do a lot of filler in acne scars,
Yes.
and even with a meso needle, a meso quantity has also caused a small vessel occlusion,
Oh.
which I've had to. It
Hylas.
happened hylas on the spot. So you have to be very vigilant. And as a practice, I ask my patients to sit for half an hour after the treatment. And then only when I feel that everything's fine, then I let them go. Because most vascular occlusions can be picked up. Look for blanching. Now, the first patient that I said, what I noticed when she came was blanching of the nasal ala, okay?
Immediately.
No, this happened, and the funniest thing is the occlusion developed over 3 days, okay? So gradually what must have happened is a filler must have got in and it led to coagulation and clotting, and it must have slowly occluded the vessel. And after 3 days, like when she came, when I saw the patient and you just do this, there is pain, there is slow capillary refill. So those are your clues. Constant throbbing pain, pallor in the affected area, and slow capillary refill. These are the things you have to look for. And the moment you hyalase it, you see an immediate improvement in perfusion.
Influx, yeah.
Influx, and you have a compensatory flush.
Flush.
That gives you a clue that, you know, the occlusion has been relieved.
And sometimes, Rickson, you know what happens? You've injected, but you don't remember because you've injected all over.
Yeah.
Now your patient has come with this, whatever happened with you. How would you know where to put? Would you just put everywhere, just on a hunch
the entire
basis?
area of occlusion. Now, what happened is with the second patient who I told you, I was doing the acne scars, okay? Now, I finished one cheek and I was on the next cheek. And I noticed an area of pallor. I said, okay, maybe because I've injected, you know, there was a halo, and I said, okay, maybe it'll wear off. But what happened was, as I was injecting the other side, I noticed over a period of time, there was a zone of redness, red, blue, that was developing around the area of pallor.
Oh.
So I said, okay, something's wrong, definitely. So what I did is, but I didn't know which exact point actually caused it, okay? So what I did is, I took hyaluronidase, diluted to 2 ml, so 1500s in 2 ml.
So 750 per ml.
Yeah, and I took a cannula and I flooded the entire field.
So that's where even your cannulas, which if you don't use a cannula comes with it, I always keep it for this.
Yeah.
You can always use.
Because the funda behind that is, see, if you're occluding, if the filler has occluded a vessel, the moment you dissolve it, it will form a smaller, it will reduce in size, and it will go ahead and block smaller vessels in the vicinity.
Yeah.
So you have to flood the entire field, because wherever the filler travels, there is hyaluronidase to dilute it, to melt it further. So I took a cannula and I flooded the entire field with hyaluronidase. It opened up the circulation. The patient was absolutely fine the next day. There was no problem. But it was something that, fortunately, I happened to catch it on the spot. And so you have to be vigilant, and it has to be very clear in your mind as to what you're doing. Like, when in doubt, don't worry about hyaluronidase. You can pump 1 vial, 2 vial, there's no problem. Okay, hyaluronidase is very safe, and when you are dealing with an occlusion or a vascular event, feel free to inject concentrated hyaluronidase, because the more you dilute it, it will be slower, because most of the fillers, if they are cross-linked, it takes time for the hyaluronidase to actually work through the cross-links and break the product. So just go ahead and infiltrate. Even if you're doing it, if a person is suspected allergy, you can give steroid, antihistamine. But in that case, it would be, I wouldn't say life-saving, but you're trying to prevent a major occlusion, because vascular occlusion doesn't look good. If you lose time, you would have to deal with larger complications later.
Yeah. So the message, I think, from Rickson's case is that, when patient tells you there is a problem, your staff has to be aligned in a way that they get the message to you. Staff may dismiss the redness as hota hai, right? But that redness could just take you down your entire career.
Just
To
add, so I always give a standing instruction to my patient: if you have continuous pain or a color change, please notify me. That is the one thing you tell people. Make the patient wait for half an hour, especially in areas where you've done it. And second thing is, tell your patient, if you experience continuous pain, bring it to my attention. If you get the patient to the clinic, check for any pallor and slow capillary refill in case of pain. and ask the patient to notify any color change on the surface. Okay?
Thank you, Rickson. Dr. Pankaj, anything, what kept you awake at night?
So I did a nose filler
Okay.
with a cannula, 27G.
Okay.
And
now you're scaring me.
yeah.
I was going to start my nose fillers.
And
okay.
this happened a day before I was going for a short vacation.
Okay.
So I was in Jim Corbett, area with a poor network.
Okay.
So I got a call next day that I'm having a lot of pain. So nose fillers, they do pain. But this patient, I checked, okay, how much pain is there? Not much, but pain is there. I said,
Okay.
fine, absolutely fine. And the second day, like, she called, the doctor, pain has increased. I said, fine, you send me picture. And the moment she sent a picture, there was a livedoid linear pattern, bluish discoloration.
On the tip of the nose.
On the tip of the nose, traveling till the glabella.
Okay.
And it was like a nightmare. So I took the car and drove back. And I called the patient that you kindly come to the clinic. In the meantime, she went to see another dermatologist, and that dermatologist said that this is herpes zoster.
This is?
Herpes zoster.
Oh.
So I called her that, please come to the clinic. And she's insisting, no doctor, this is herpes zoster. I've got it once earlier as well. So you need not to worry. I said, I have to worry. You please come to the clinic. And I told her that, the process, probably this is a vascular occlusion and a complication of the filler, and I have to give you certain injections on the nose to dissolve it.
Okay.
And because of the shape, she was happy. No, doctor, I'm loving the shape and all these things, and please don't remove it. And the moment I gave first injection, it was like, of course, there was a lot of pain, edema, and lot of tenderness, and she was not cooperating at all.
So high lace you put with cannula?
No, with the needle.
Achha, high lace you put with needle?
I first gave droplets after topical anesthesia on the areas where the livedoid pattern was there.
Okay.
But she was not cooperating.
Okay.
And eventually I called anesthetist, called her parents, gave IV anesthesia, then with the cannula and with the needle, infiltrated all the area. Eventually the area improved. But on 7th day, there was a bit of scabbing. The scabs were superficial, not too deep.
Okay.
Which healed in 15 days. There is a bit of scarring at the tip of the nose, which I treated by fractional CO2 laser over 3 months. And everything went well.
My God.
Till date, she doesn't believe that it was vascular occlusion. She insists that it was a herpes zoster.
Okay, I have a question. Have you again done nose filler after this incident?
I have, but I aspirate. 27G has been out. It's only 25G.
25G.
And I always aspirate, and I have got positive aspiration with 25G twice in columella.
Yeah, that's... No, don't do nose fillers. That's better.
Yes. So
I can't do that.
These days, I only do nose fillers if a patient insists. I don't think in a country like India where people do not pay you much for a filler,
Yes.
35, 40,000 rupees for one syringe, it's
That
not
also
worth.
you are lucky. Mumbai rates are not so much. 35, 40. No, we don't charge.
Not worth taking the risk.
Yeah, that I agree. Definitely.
So I just correct the bridge with a needle. Tip lift, I avoid. I try Botox. Otherwise, I do not do much when it comes to nose.
So from Dr. Pankaj's case, the message is, sometime you have to give up your vacation, right? Then you need connectivity. So, a couple of times when I travel with my husband, I say, no, I don't want roaming because I don't want to be bothered. But I think you have to be really connected with your patient. That's very important. They should be able to reach you. Of course, there will be some unwarranted calls, but yeah.
I don't do fillers 3 days before a holiday. Ever. That's the rule. 3 days before holiday, no fillers.
Yes, Dr. Malvika, we want to hear from you.
Actually, I don't have such a colorful story at all, except that all these years of filler practice, just in February this year, I got my first complication. That too, like Rickson said, it was from a skin booster, the 20 milligram per ml one. And all I was trying to do was chase a superficial scar out here. And I was superficial. Evidently, the 20 milligram must have been a bit heavy, or the product amount went in a little deeper. And this is the infraorbital area. And there was a vascular occlusion, which unfortunately the patient had left already. So developed. Next day she said bruise, it looked like a bruise. 2 days later, you could see the pallor and the livido. But by that time, she'd already traveled, gone back, and could not come back.
So you haven't been able to resolve it.
No. So then I had to refer her to a colleague
Okay.
where she was, and then after that, I've been hand holding her till today because it is my responsibility. I will always own up to what I did inadvertently, or because it's always inadvertent. In the best of hands, things happen.
Yes.
So I think you should own up for what you do. Kudos to you for coming down. I should have probably gone and flown across, and I actually wanted to go and do it myself, but she said, "Don't worry, doc, I'll go wherever you recommend. I'll go," and the patient was really nice.
Yeah.
And I think that also is a really important. It doesn't happen always, so we really have to own up. We have to say this has happened, take it up, clear it till the end, like you did.
Yes.
I think that is the responsibility you take when you take on aesthetics.
Yes, very well said. Okay, so Shreya, when we are reaching the time, you tell me, because my panelists are such a khajana of knowledge that I can go on with them. So tell me when we have to get off the stage and we want a stage photograph. Okay, now we come to the next favorite molecule for everyone, which I feel is something for people to actually start with. You know, I should have put toxin before fillers slide. Okay, now Dr. Soma, there are a lot of newer products, right? In fact, I don't know in fillers how much does it matter, but sorry, in toxin. But do you have a favorite toxin and why over others?
So I would not say a favorite toxins, but there are times when I take a call on which toxin to be used, because now we have toxins which are like pure toxins. We have toxins which have complexing proteins which take a little more time to act
So
over
which
the
is
time.
your favorite? I'll rush you now.
Okay, so I like obviously the first one is Botox, which I use.
Which is a protein toxin.
Yeah,
which is a complex protein.
And second now I like is the Dysport.
Dysport is also complicated.
Yeah, but then still your mode of action is faster.
Okay.
It starts earlier than the Botox.
I don't like the design of the bottle though, but I agree.
Yeah.
It's terrible. My 10 units are wasted in the bottom. I hope somewhere somebody is listening. Rixan, your favorite toxin?
They sell you by telling that there are 20 units
Extra, which I tell them that, you anyway wasted and they don't give a bottle opener. So, with my nails, I don't care. I just, it doesn't go in. It's a very stupid bottle according to me. Yes, Rixan.
I think it would have to be a tie between Botox and Dysport.
Sorry?
It would have to be a tie between Botox and Dysport.
Okay. Botox and Dysport only. Same? Doctor?
So I like both of them equally. Botox because of ease and the brand value.
Yes.
Because patients, they come and they say that,
Yes.
doctor, I want Botox. It's very difficult to convince them. But Dysport, yes, it works a little faster. So third, fourth day, I can see good results. And longevity is same.
Okay.
Yeah.
And Dr. Malvika, anything different? Why are we not talking about the pure toxin? Yes.
Actually, I think, like we said, I think have the maximum comfort level, and we've used Botox, the brand, the most. So therefore, you tend to turn to that more. That doesn't mean that the others are not good. They're good. You just need to work with them longer to have a comfort value. But one thing I would like to share in my experience is that now I do Dysport over here in the glabellar complex. Fabulous results. It's overcome a lot of this residual, action which leads to that 11 persisting. And then you want to do a filler here, and now we don't want to do a filler here because we're so worried about vascular accidents out here. So I find that Dysport in the glabellar complex works beautifully. It's also FDA approved, very safe to do. And I find that the other toxins work equally well in the other indications. And in Dysport, you have a predicted number of units you use, and it always works. The predictability is also very good. And with the other toxins, since they all work almost the same, then you can decide your comfort level, or you can decide your patient preference. It's nice to have a variety, I think.
Right.
And have the expertise in the variety. But Botox and botulinum toxin are synonymous. It's for us now to develop it.
True.
And that's the trend I would say we should adopt.
And Dr. Malvika, you have a 25 years plus practice as compared to the other panelists. Now, in this long duration of your practice, because we speak a lot about resistance, antibodies to to toxin. Have you experienced it? Have you experienced antibody, and how?
I get you. So what Dr. Abritam is trying to say, which I think you all must have seen too in your practice, is that the same patient who's done the procedure with you at least 3 or 4 times will come on the 5th time or the 4th time and say, it doesn't work anymore. It's not staying that long. It doesn't last that long, or it doesn't work anymore. And then you have to look at certain complex factors. And I'm sure one of them must be antibody, but we've not tested our patients.
Exactly.
But I'm not sure it is antibody. I think sometimes, patients develop a thyroid problem. Sometimes they're very stressed out. Sometimes they lost weight. And so their facial features change, or yes, higher metabolic rates do tend to wear off the toxin faster. Maybe sometimes, you didn't go in the right way.
But what would you
Technique
do?
related.
Suppose I'm your patient and I come to you that, every time it works for 5-6 months, this time it went away in 2 months.
Yeah.
So would
what-
you switch brands or would you give me more Botox?
See, you always ask these difficult questions.
That's why I'm here and you are sitting. Yeah, so would you switch brands? I am somebody I need specific answer,
Yeah.
sorry. So
I will
would
give
you
you a specific
would you
answer.
switch brand or would you inject more dose?
Yeah. If they come at 1 month, then I would give them a touch-up.
Okay.
Because Botox or botulinum toxin A can take even up to 1 month to work fully. I would assess other reasons for why it's not working, which I just outlined, and there may be a few more. And if they come at 6 months or 4 months or 3 months, usually they come at 3 and say it hasn't lasted,
Yes.
I would switch toxins, but I'd tell them
Okay.
that maybe this is not working for you anymore, I'm switching. Are you okay with the switch? They should be aware of what you're doing. You just can't switch and then, say, yay. The patient has to know what you're doing to them. Or they may say, okay, can you put some more for me? But you have to tell them, if you put some more, then it's going to cost you more.
Yeah,
Let's be
that's-
frank with our patients. Let's be friends in this journey. Right? We're partners and friends in this journey. You really build a loyal clientele. Because then you're not trying to hoodwink them, and they know you're being absolutely honest with them.
Absolutely. Lovely. Dr. Pankaj, are you going to tell about toxin? Because I have a thread question for you.
Most of the patients who come after 1 month that Botox hasn't worked, I find that suboptimal dosing is the most common reason, right? They'll say, oh, we just want a bit of Botox, very natural results, shouldn't be frozen, but actually they want good results.
Yes.
You'll give them 25, 30 units and they'll say, doctor, still the lines are there. That time they forget that they ask for natural results.
Yes.
So if I have recommended suboptimal doses, I'll say, you need to take more. If proper doses were there, then we can increase the doses first, and after that also the patient has the same complaint, then switch
So
the
do you call it a baby Botox?
No, I don't call baby
Rickson, you
Botox.
call baby Botox?
No,
That's
no,
a
I don't call
micro
baby to anything. But I always tell people that as you get older, your doses increase because your collagen's reducing, so your muscles are becoming, just with the same amount of action, your muscles are leaving a bigger imprint. So the dose just increases. That's
So you
all.
don't give baby Botox?
No baby anything.
Soma, you do baby Botox?
Yes, but not for this kind of indication. We
Okay.
do give baby Botox specifically.
So in
I
your
do it more on the
definition,
neck.
what is baby Botox?
See, baby Botox, you can take it in 2 ways. Either you super diluting the product, or you're
That's
using
meso Botox.
Yeah, or you're using the same amount of dilution, but you're getting very less amount in the particular area.
Malvika, according to you, what is baby Botox? Audience want to know. Baby,
Baby
Botox.
Botox is what social media calls micro or meso Botox. It just sounds cute, it sounds hip, and it sounds happening. But we over here know that we are diluting the botulinum toxin to 1:1, 1:2, 1:4, and putting it intradermally, and you can space it out everywhere, and the skin looks smooth like a baby's bottom.
Oh. Okay. So I was just told that we have less time, so I'm going to bring out my last slide, which is facials, medifacials. So I suppose we all are in that zone now that we have medifacials in our clinics. So, Hydra Facial particularly, of course, it's a brand. I should have put TM there. Now, would you go with the branded machine, or you would even go with the newest Chinese, Korean devices which are 1/10 the cost?
May I take
So-
this question because I must share a little bit of my journey with medifacials. back in the day when I started Medifacials in the clinic, everybody was like, why do you want to do facials for your patients? But facials that are not, we never did the conventional ones that you do in a salon. We always used it machine based.
Yes.
Machines have been evolved. The first machine I ever had was Korean.
Yeah.
Then I went to the UK myself and brought back a UK machine, which only I in India had because there was no distributor. And it
Okay.
was very difficult to get the probes and the products, but I managed. It was a top seller.
Okay.
Like earlier said in the panel, it brings in the footfalls. It also is a feel good, so patients come and go. They don't need to see you every time. And also now with technology, hydrofacial, Mira Peel and Oxygen
BB
Neo and
facial.
all these facials that have come in, there is technology that is being used and the product quality has also gone up.
Yes.
At that time, we didn't have such great quality products.
True.
So I think the Medifacials have a definite place in our practice and add that feel-good value. And they're a stepping stone towards patient confidence build-up to the next procedure.
Right.
And they're a good add-on also to your products. And a good one for tan removal, party ready, event, bridals. They make a lot of difference in that
Right.
genre.
Dr. Pankaj, why will your patient choose you or Medlings over salons where they are being offered facials for 1/4 the cost?
So first, as Dr. Malavika said, I use these original branded machines when it comes to facials because
Okay.
there my skills are not involved. It's basically the technology and the trust that if they're getting hydrofacial, it will be hydrafacial. It won't be a hydrofacial or
Hydrofacial.
a hydra cool facial or something like that.
Correct.
That's number one. And number two, these facials, of course, they give good results, but even after facials, there are complications. Sometimes there are rashes.
Yes.
After hydrofacials, many patients have seen that like acne broke out. So we are in a position we can manage these complications.
Yes.
So trust factor is there. So patients, they say that, if I'm getting a facial, why not at Dr. Pankaj's
Medlings,
clinic?
yeah.
Because if something happens, he's there to take care of me. So that trust and bonding
So that
there.
is the thing, that why patients will come to you if you start facials at your clinic is because they feel that comfort. They feel if something goes wrong at a particular salon, they are not going to do anything about it. They are just going to turn their back or give some reason. So here, you take on the headache. So Dr. Dixon, where would you advise young budding dermatologists and aesthetic doctors to get a training on medifacials? Because this is something not taught in medical colleges.
So I always tell my patients, they ask me what are medifacials. I always tell them, see, if you want a glow, a peel can give you that glow and a medifacial can give you that glow. You tell me what kind of person you are, whether you like short treatments or you want a little bit of pampering. Because what we do medifacials is a basic, a peel in a facial format. So I have patients who like only doing peels, they like short treatments, and there are patients who want to be pampered, who want to spend 45 minutes to an hour. So that, they like that I ask them that, and then there are people who only do peels, they are happy with the glow. There are people who come and do medifacials. And medifacial per se is all what you have in the clinic. I'll do a laser treatment followed by a mask and followed by electroporation. Sometimes I'll do, say, a microneedling followed by, so you can put whatever you want under the term medifacial, and whatever appeals to you, that's what you would put in your medifacial. And then you can design it the way you want, you can label it the way you want, you can call it anything. The ultimate result is you need to have a good glow, without any downtime and least possibility of any side effects. Okay, a patient should be able to walk out of your clinic looking good to a party without having to worry about any rashes or spots. That is what to me is a medifacial. Okay.
Yeah. So that is the message from Dr. Dixon, that congresses like aesthetic medicine, what is happening here, you get a lot of know-how about salon treatment. So if as a doctor, if you can incorporate those with your technology, like for example, you do a carbon facial, right? That's something very popular at my clinic. So that's like, we do an exfoliation, we do a steam, we do an extraction, then I would put in a Q-switch ND-YAG laser, and then I would put a mask, right? Or a peel-off mask, depending on what. If I want to cool it, then I'll use a cool hammer. So, we as doctors, we have to open our eyes to other possibilities also. So don't be like, very restricted of being in a doctor's this thing. Of course, you can include lot of other things and put a lot of variety. For example, the mask itself. You know, there are a lot of brands you'll see, probably I haven't seen the stalls. You know, you can change masks. You know, sometimes if we put on Instagram a blue mask, the patient say, I want facial with that mask only. Now, probably we wouldn't think, but now we have standardized that in summer the treatments will have cool. Sometimes we have blue for men and pink for women. So I think it's you know, with your knowledge base is already there, you have to just add on all this. I know Shriyal is giving me looks. So I have this is my last slide, trust me. Dr. Malvika, with 25 plus years of, I don't know what's happening, my questions are running. With 25 plus years of experience in aesthetic practice, now you are a legend. What is the best compliment you have ever received from a patient, which you still remember?
That's such a lovely question, and I only think, no, this is my chance to describe Dr. Apratim. She's daring, she's sassy, she's savvy, she's always been there ahead of the curve, and she keeps us all on our toes.
Oh, thank you.
So I think the best compliment is that I have a legacy of patients who come to me, then their daughters, now their granddaughters, and some of my patients have been coming to me for the last 20 years, or they come back after 18, 15 years and say, Doc, you sorted me out there, now you know, we've come back to you for a new problem, and they say that you're my only dermat. You're the only one I trust my skin with. And it's a wonderful feeling.
Yes,
it's wonderful to see them again. It's wonderful to take care of them. And another thing in the injectable practice is that I have patients with me for more than 15 years, 18 years, and I've made their faces the best versions of themselves without distorting it, and they love it. When they come back for so many years,
yes,
that itself is a compliment.
It's a high feeling. Lovely.
Thank you for the question.
Yes. Dr. Pankaj, when someone asks you what is the secret of your good looks, good skin rather, what do you say? Do you put it on genes or do you put it on treatments?
Treatments, of course.
Treatments, see? So that's why everybody in this room has to work on their own skin. That's very important.
So
Yes.
first thing I tell that, whenever I introduce a technology in my clinic, I'm the first guinea pig. I try myself, and when it works on me, then only I purchase and
Lovely.
use on my patients.
Yes, yes.
And of course, I take all my treatment on a regular basis.
Lovely.
And the treatment which patient asks, which treatment, is actually the treatment which I'm about to recommend her.
Yeah.
So it's the same treatment which I just recommended you. That's the treatment which I take on a
Lovely.
regular
Yeah,
basis.
yeah. See, that's again something, when patients come, they say, Doctor, have you done it? And the moment you say, yes, I have done it, you see the conversion. So obviously, right, people don't come and say, I want Katrina Kaif lips or I want Shah Rukh Khan's face. They will come and say, I like the way you look. So that's why we have to be role models in every way. Be it weight, be it skin, be it hair, and be it makeup. So Dr. Soma, you see, I've seen your Instagram. Morning, more than putting the slides, I was seeing everybody's Instagram. So I saw you very trendy. I love that, you can wear what you are wearing, the jumpsuit now. You wear saris. You experiment a lot with clothes. So how you pick a dress to wear to a clinic? Because I'm still stuck in my trousers from last 20 years. I can't wear a dress.
For me, dressing obviously is something which gives me a lot of happiness, and I always feel when you come with that vibe to the clinic, you pass on that vibe to your staff as well as your patients. And I would love to relate to my patients who come over right from a homemaker to a professional.
Yeah.
So that's where I've realized that dressing yourself that way also puts an impact in your practice.
Yeah,
and I
it
think
does.
everybody, I'm assuming all of us will agree here that whenever you see a pleasant personality across the table with nicely groomed, I'm not saying that you have to look very, very, absolutely audacious, but if you're presentable, groomed well, with good hair, then the patient itself, I think 50% gets convinced that I'm at the right place.
So which is your favorite? Soma
I love
in
my
sari
saris.
or Soma in jeans? Soma
I
in
love my
sari.
saris.
I was actually expecting her in a sari today.
Yeah. It was just because I was rushing. The sari takes a little more time to drape.
Yes. So yes, Dr. Rickson, you are a Bollywood doctor. Actually, everybody here is. But so, which is the most popular celeb treatment in your practice? I mean,
Celeb treatment, I
done
would
for
say-
your celebrities.
Actually, celeb, I would say most popular, I would say maybe a little Botox and fillers.
Okay,
Yeah. I mean,
injectables.
people do laser hair removal, laser treatments. I'm mostly known for my laser. These people come to me asking for lasers, but yeah, a little bit of Botox and fillers.
Yeah, I would have said that,
The
but
thing about celebs is, like, if you ask me the truth, there is a lot of hand holding and nobody's prepared for downtime. So I tell them, you don't need it, don't do it. If you ask me frankly, because even if there's a 1920 difference in symmetry in both sides, you have to sit overnight. They have given me sleepless nights. So
Yeah.
I tell them, you don't need it. You're already celebrated for your looks, and there's a reason for it. You have good genes, everything. And I only do small tweaks.
Yeah.
I don't ask for this because ultimately, for the amount you get paid for that, it's not worth it. So I am the kind of person, if there's a politician or a celebrity involved, I tell them, you don't need it. I go minimal because it's a headache. And especially when you're scrutinized for every small thing on your body,
Yes.
it backfires. You get one negative comment and all that stress will come onto you. So if you ask me, all those celebrities come, I actually do the most minimal things on them, and that's why you will not. If there's anything really outrageous out there, trust me, I'm not the one who's done it. Okay.
Lovely. Yes, yeah, Abhijit.
Absolutely, and I'll tell you the most beautiful looking women who are the most beautiful looking in the industry. Consider even they are so insecure. Like you have to literally tell them that you don't need anything. You are good looking. Like they'll come one negative comment and then they're like, okay, is something wrong with you? Do I need to fix it? I said no. Ignore the comments because they'll come to you to change every small thing, and you have to be able to convince them that they don't need it. Otherwise, if something goes wrong, if there's a downtime or this, it'll come back to you, and you will have sleepless nights till you fix it or till you handhold. So even though there's a whole thing with, if there is a celebrity involved, I at least I give the most minimally invasive, anything that doesn't drastically change their appearance. Because if it has a negative, this
But you know, you're the most popular with celebrities among dermatologists. Trust me.
I don't know that.
I do
don't know
those
that.
all ratings, all the time on doctors, and he is the most trusted dermat.
Okay, I don't like doing this because this is a very interesting session and discussion, but we'll have to bring it to its
But
end.
Shriyal, because of you, I've cut down my slides to 70%. I only presented 30%. So sorry, audience, it is her. She didn't give me enough time.
Okay, I take that on me. But yes, thank you so much, all the doctors. A great discussion. I think a lot of knowledge sharing, a lot of interesting experiences to learn from, and a lot of tips that came to the table from here. So thank you so much. Before we move on to our next session, a token of gratitude from my end, please, to all the doctors.
And also, please, everybody follow all of us on Instagram. My handle is cutest.in. If please you're following, thank you so much. But please, everybody follow. Malvika, your Instagram handle, though you don't seem to be very active. You are? Okay, sorry. What is your Instagram? What is your Instagram handle, Malvika?
Dr.Malvika Kohli.
Dr.Malvika Kohli. Pankaj.
Mine is Medling's Aesthetics.
Medling's Aesthetic. Rickson.
Dr. Rickson.
Dr. Rickson. You will get it on
Dr. Soma Sarkar.
Yes.
Actually, you all can follow Aesthetic Med India, and you'll have all of them there. Thank you so much. Thank you so much. I'm so glad you got such a good Thank you so much.
Wait for the group picture.
If you all could just step down for a group picture, please. Thank you. Thank you so much, doctors.